in 24 horses? A. 500 milliliters. B. 1200 ml. C. 850 milliliters. D. 2000 ml. Correct answer. The total volume of CSF is 150 milliliters for the average adult, where 125 milliliters is confined to the subarachnoid spaces and 25 milliliters to the ventricles. CSF is renewed 4 or 5 times over a 24-hour period, and the total volume of CSF produced is roughly 580 milliliters per day. CSF found in A. Epidural space. B. Subdural space. C. Subarachnoid space. D. All. Correct answer. Cerebrospinal fluid (CSF) is a clear, colorless, watery fluid that flows in and around your brain and spinal cord. Your brain and spinal cord make up your central nervous system. It controls and coordinates everything you do, including your ability to move, breathe, see, think, and more. When a person is sitting, the CSF pressure is about A. 10 cm HO. B. 30 cm HO. C. 10 mm H0. D. 30 mm H0. No. Correct answer is B. CSF pressure, as measured by lumbar puncture, is 10 to 18 cm/HO, 8-15 mm of mercury or 1.1-2 kilopascals, with the patient lying on the side, and 20 to 30 cm/HO, 16-24 mm of mercury or 2.1-3.2 kilopascals, with the patient sitting up. If a person is moving from a lying position to a sitting position, then what effect will be seen on CSF pressure? A. It will increases. B. It will decreases. C. It will remain unchanged. D. It may increase or decrease. Correct answer. Temperature regulating center of the body is A. Medulla oblongata. B. Thalamus. C. Hypothalamus. D. Pituitary gland. Correct answer. Normal pH for arterial blood is A. 7.42. B. 7. C. 7.3. D. 7.5. Correct answer. The pH is in the normal range, 7.35-7.45. Use a pH of 7.40 as a cutoff point. In other words, a pH of 7.37 would be categorized as acidosis, and a pH of 7.42 would be categorized as alkalemia. Which of the following is related to vision testing? A. Acetic acid. B. Litmus paper. C. Tuning fork. D. Snellen, S. Correct answer. A Snellen chart is an eye chart that can be used to measure visual acuity. Snellen charts are named after the Dutch ophthalmologist Herman Snellen, who developed the chart in 1862. When plasma enters the tissue, it is called A. Blood. B. Lymph. C. Capillary fluid. D. Interstitial fluid. No. Correct answer is D. Interstitial fluid is the fluid that surrounds the cells in tissues. It comes from blood plasma and plays a crucial role in the exchange of nutrients and waste products between the blood and the cells. The transportation system of blood is A. Cardiovascular system. B. Urinary system. C. Endocrine system. D. Integumentary system. Correct answer. Addison and H039, S disease is caused by insufficiency of hormone. A. Thyroid hormone. B. Parathyroid hormone. C. Corticosteroid hormone. D. Insulin. Correct answer. Addison's disease is a rare but serious adrenal gland disorder in which the body can't produce enough of two critical hormones, cortisol and aldosterone. Patients with Addison's will need hormone replacement therapy for life. An artery that supplies blood to the head and neck. A. Carotid artery. B. Coronary artery. C. Mesenteric artery. D. Intercostal artery. Correct answer. Your carotid arteries are blood vessels that supply blood to your brain, face, and neck. You have two common carotid arteries, one on each side of your neck, the left common carotid artery. Right common carotid artery. Insulin is secreted by A. Alpha cells. B. Gamma cells. C. Beta cells. D. Delta cells. No. Correct answer is circa. Insulin is secreted by beta cells. Beta cells are located in the islets of Langerhans in the pancreas and are responsible for producing and secreting insulin. Chyme is called A. Food in mouth. B. Food in the stomach. C. Food reached in the stomach. D. Food reached in the rectum. No. Correct answer is B. Chyme or chymus is the semi-fluid mass of partly digested food that is expelled by a person's stomach, through the pyloric valve, into the duodenum chyme. Skull consists of A. 14 bones. B. 12 bones. C. 22 bones. D. 13 bones. Correct answer. The skull consists of 22 bones. These bones are divided into two groups, the cranial bones and the facial bones. The cranial bones protect the brain, while the facial bones support the muscles and tissues of the face. Longest bones human body is A. Humerus. B. Femur. C. Tibia. D. Fibula. Correct answer. The hormone controlling the use of glucose by the cell is A. Steroids. B. Growth hormone. C. Insulin. D. Thyroxine. Correct answer. The hormone that controls the use of glucose by cells is insulin. Insulin is produced by the pancreas and plays a crucial role in regulating blood sugar levels. It allows cells to take in glucose from the bloodstream and use it as a source of energy or store it for later use. Insulin helps maintain normal blood glucose levels by promoting glucose uptake by cells and inhibiting the production of glucose by the liver. T cell is mature in A. Liver. B. Thymus. C. Spleen. D. Kidney. Correct answer. The thymus is a specialized organ where T cells develop and mature before they are released into the bloodstream to perform their immune functions. O-positive blood group not available in blood bank. Which blood may be given to patient? A. A positive. B. A flat positive. C. O negative. D. B positive. No. Correct answer is circa. Type O positive blood is critical in trauma care. Those with O positive blood can only receive transfusions from O positive or O negative blood types. Type O positive blood is one of the first to run out during a shortage due to its high demand. Which enzymes immediately present after attack of myocardial infarction? A. CPKMB. B. Troponin. C. Erythropoietin. D. Antinatriuretic peptide. Correct answer. The proteins are released into the circulation between 3 and 4 hours after myocardial infarction and remain detectable for 10 days following. There are a number of causes for troponin elevation not related to myocardial infarction. However, troponin elevation is much more sensitive than myoglobin and even creatine kinase. Hair color in human turn white due to absence of which of the following pigments? A. Bilirubin. B. Biliverdin. C. Melanin. D. Melatonin. Correct answer. Melanin is the pigment responsible for determining hair color. When melanin production decreases or stops entirely, typically due to aging or other factors, hair can turn white or gray. Therefore, the absence or reduction of melanin is what causes hair to lose its color and appear white.